Hi, my name is Samantha Cueto, and I will be presenting the research work that we have been conducting this summer alongside Melissa Murin. So our research study is titled Cope and Pace, Reducing Neuropsychiatric Symptoms in Dementia Patients. Now, what is COPE? COPE stands for Care of Persons with Dementia in Their Environment. PACE stands for Programs of All-Inclusive Care of the Elderly. So COPE is an evidence-based intervention that will be tested into being implemented into an existing service model, PACE settings. We are currently testing this because there's currently an absence of large-scale approaches to delivering these types of interventions, as well as a lack of accurately measuring fidelity for these interventions. We will be testing two types of training models, which will be asynchronous online modules, as well as traditional methods of synchronous sessions. We will be comparing how occupational therapists and registered nurses receive both training modalities and their outcomes, as well as the fidelity of both modalities and how both these modalities benefit the dyad, which stands for the person living with dementia and their caregiver. Now, COPE is extremely important in that it not only is helping the care receiver, but the caregiver. Caregivers are usually very stressed and have poor health due to the large and copious amounts of works that they must do for the care receiver. COPE is also important in that it tailors activities according to the person living with dementia's capabilities and interests. We are also going to be using natural language processing methods in order to present a large-scale solution for fidelity monitoring. So overall, I have been extremely glad that I have been able to work in this type of project because Cope and Pace really represents why implementation science is important in the research field, especially as of recently. These evidence-based interventions are devised in research studies and are unable to be properly implemented. Cope and Pace will attempt to come up with a solution to properly implement these evidence-based interventions and therefore set a precedent not only for the geriatric field in terms of interventions, but hopefully for other clinical settings as well. I also am glad to be helping with the COPE program because COPE is instrumental in that it is helping caregivers as well. Thank you so much in advance, everyone.
Hello, my name is Melissa Murin. I am a sophomore in the college studying psychology and anthropology. I had the pleasure of working with the Hodgson team this summer on the Cope and Pace project. The Penn portion of the team focuses on analyzing the efficacy of online modules as compared to a traditional method of delivery. The sample consists of 10 PACE sites that will have up to 2 OTs and 1 RN trained to administer COPE. Each site will administer COPE to 5 dyads, which is defined here as the person living with dementia and their caregiver. The measures that will be evaluated include health-related quality of life, functional ability, and neuropsychiatric symptoms for the person living with dementia, as well as well-being, skills, and stress reduction for the caregiver. As an aspiring clinical psychologist, I find the innovative ways that COPE aims to reduce emotional distress in both the person living with dementia and the caregiver so important to furthering dementia treatment. This project helps to affirm the person living with dementia's wishes and include them in the formulation of their treatment plan, which helps to preserve dignity. Some of the instruments that we use for implementation mapping include FRAME, ERIC, NOMAD, and ORCA. FRAME and ERIC are used to evaluate the implementation of the intervention, whereas NOMAD and ORCA are used to evaluate health partner and dyad outcomes. A key component of this evaluation is fidelity monitoring, which will be done through transcriptions and machine learning capabilities. To sum things up, Cope and Pace aims to introduce evidence-based practices in clinical settings with Medicare and Medicaid recipients. The Cope and Pace project is currently undergoing beta testing with 2 sites, and the preliminary results show that preparedness scores may be lower with OTs, though these are from a small sample size, so it may not be significant. Currently, the fidelity monitoring software with machine learning is still being developed using traditional fidelity checklists. Some of our current hypotheses include that the virtual modules will provide similar, if not better, fidelity, and we also predict, based on past research linked in references, that caregiver burden will be reduced through COPE. We would like to thank our PERM mentors, Dr. Nancy Hodgson, Emily Summerhays, and Sonia Talwar, along with Sarah Bueno, for all of their work this summer. Thank you.